Medicaid is a federally imposed entitlement program that funds health care for the poor, and it is a budget buster. Annual spending, which is split between Washington and the states, is now more than $450 billion. This is a shocking figure considering Medicaid at first cost less than $1 billion and supposedly was never going to be a significant item in the budget. But $450 billion is just the tip of the iceberg. The Department of Health and Human Services projects that the annual budget for Medicaid will consume about $900 billion in less than 10 years, with $542 billion of that coming out of the federal budget. And the long-run numbers, they're even more frightening. To be blunt, America will be in danger of becoming another Greece if we don't fix this problem. Fortunately, there is a simple solution. This Center for Freedom and Prosperity video will explain that the federal government should abolish Medicaid and instead give states block grants so they have the flexibility to figure out how best to provide health care for the indigent. This is the approach that made welfare reform a big success, and there's every reason to think it will be equally effective as health care reform. I'm Dan Mitchell of the Cato Institute. Thanks for watching. Block granting is a very simple concept. My colleague at the Cato Institute, Michael Cannon, succinctly explains the who, what, where, when, why, and how. Congress should cap federal Medicaid spending, block grant federal funds to the states, and allow states full flexibility to define eligibility and benefits under their respective Medicaid programs. And Michael goes on to point out different things that could be used to then make the program more effective. Medicaid reform of this type would completely reverse the bizarre incentives that make the program as currently structured so dysfunctional. Under current law, Medicaid is a matching program, so politicians at both the federal and state level have an incentive to expand benefits and beneficiaries, since they can dole out $1 and only be responsible for a portion of the cost. A block grant system, by contrast, gives state politicians full authority and responsibility of deciding how best to allocate the health care dollars provided by the federal government. States could choose, of course, to spend even more. The good news is that some lawmakers and some responsible left-leaning policy experts are embracing this kind of approach. Congressman Paul Ryan, the chairman of the House Budget Committee, has teamed up with Alice Rivlin, who served as director of the Office of Management and Budget for Bill Clinton, to offer a block grant proposal. Here is a very simplified description of the plan's basic approach. Starting in 2013, the federal share of all Medicaid payments would be converted into a block grant to be allocated among the states. The total block grant would increase annually along with currently projected growth in the Medicaid population and with growth in GDP per capita plus 1 percentage point. The Ryan-Rivlin formula is probably overly generous. Ideally, the block grant should be capped and then slowly phased out so that the program becomes solely a state responsibility. But compared to current law, which allows spending to explode, the Ryan-Rivlin proposal would generate significant budgetary savings. But Medicaid reform is not just a budget issue. Block granting the program also would address some of the other flaws that make the current system so counterproductive. Instead of a one-size-fits-all program designed by Washington, block grants would enable states to innovate and experiment as they seek ways to provide better health care. States that do find successful approaches will become role models, and the policies that work will spread across the nation. Let's conclude by explaining that Medicaid reform also could help restore market forces to the healthcare system. Government intervention has crippled the normal functioning of the price system. Third-party payer is pervasive, with consumers directly paying only 12 cents out of every healthcare dollar they consume. Much of the problem is driven by government programs such as Medicaid, which lead people to treat health care as a free lunch paid for by someone else. And when any of us get to shop with other people's money, we're not going to be good consumers. What would you do, for instance, if I told you that I would pay 88% of your next restaurant meal? Would you be more likely to eat at a fast food restaurant or a fancy steakhouse? The answer is obvious, and it explains why our healthcare system is characterized by rising prices, stifling bureaucracy, and vast inefficiency. Medicaid reform, assuming states approach the issue intelligently, could be part of a solution to the third-party payer problem. But even if states screw up, and I'm quite confident basket cases such as Illinois and California will be in this group, at least we know block granting will be good news for taxpayers while also giving the more sensible states the opportunity to effectively target healthcare spending and solve these problems. If you agree that entitlements like Medicaid need to be reformed, please share this Center for Freedom and Prosperity video.